And we need our pediatricians to stop getting bonuses for vaccinating our children.
They're typically incentivized directly by HMOs. HMOs buy and sell vaccines, so vaccines are big businesses for HMOs. But the incentivization is usually anywhere from $200 to $600 per fully vaccinated patient, as long as their vaccines, a certain percentage of their practice is fully vaccinated. So some pediatricians can make upwards to $1 million or more a year just in those incentives.
These childhood vaccinations, the people of America are telling us they are not safe and effective. We are seriously concerned at Children's Health Defense about the disinformation and misinformation out there, being told these vaccines are safety trialed. The safety studies are so good.
Ms. Tommy is the director of Children's Health Defense TV and is an internationally recognized health freedom advocate, filmmaker, and author. She is here today to talk about her son, Billy. Ms. Tommy.
My son Billy entered the world as a healthy, perfect baby with an APGAR score that reflected his perfection. We followed every wellness check, every vaccination schedule, believing in the system that promised our child safety. For his entire first year, Billy thrived, meeting milestones, crawling, babbling, growing. Yet everything changed at 13 months, the day he received the MMR vaccine, the only one on the schedule back then. That day I walked into the doctor's office, trusting the advice of professionals who emphasized the importance of vaccinating against deadly diseases like measles. Billy had just finished a round of antibiotics, but the nurse reassured me that the MMR vaccine was essential. Like any diligent parent, I followed these instructions. Hours after the vaccination, Billy's perfect world shattered. He became lethargic, sleeping for long stretches. When my husband came home that afternoon and went to check on him, Billy was convulsing, his tiny body gripped by seizures. We rushed him to hospital, desperate for answers, but the doctors, after hearing he'd had the MMR, said, "It's perfectly normal, it's perfectly common. Lots of children have seizures. He'll be fine. Antibiotics, Tylenol, he'll be fine." But he wasn't fine, and he's still not fine, age 29. He's severely sick with severe autism. We made the movie Vaxxed to try and understand and warn the world about the real dangers of the MMR vaccine. I even vaccinated my child after I had Billy because I was so pro-vaccine and so into the system. Just the MMR was the problem. But then we got out on the bus. We took a bus and we traveled around America, listening to parents around America, what had happened to them when they vaccinated their children. And what we saw was utterly horrific. We saw so much death following baby vaccines. These parents would vaccinate their perfectly healthy child, and then their child would die. We saw a video at the beginning of this about the whooping cough. I've interviewed so many parents, and one comes to mind, Carrie Bundy's baby. At 4 months old, she pleaded with the doctor, "Should I vaccinate my child? He's premature." "Oh, yes," said the pediatrician. "If you don't vaccinate your baby, he could die of whooping cough." She vaccinated that baby, and he was dead in his crib following that. That is the same story we hear over and over again. These childhood vaccinations, the people of America are telling us they are not safe and effective. We are seriously concerned at Children's Health Defense about the disinformation and misinformation out there, being told these vaccines are safety trialed. The safety studies are so good. Yet all we see is death and destruction over and over again. Babies, teenagers, HPV Gardasil, their ovaries are shutting down. They cannot have children anymore. The parents are reporting paralysis. Children paralyzed from the waist down. You shout out about polio to us. I have never seen so many crippled children around America. So many children in wheelchairs, unable to walk, talk, speak, on ventilation. Parents are trying to tell their story while putting a feeding tube down their child's to bleed out the lungs, bring out the lungs, while they're trying to tell us what has happened. Two little 2-year-olds who can't hold their heads up because they had one Hep B vaccine. And then you shout out about measles to us. Those 2 girls in Gaines County, they did not die of measles. Children's Health Defense have seen the medical records. We have had experts break down. Yet still, I sit here and I hear over and over again that those 2 girls died of measles. They did not die of measles. And yet, the press and others consistently shout out that vaccines are safe and effective. They are, vaccinate your family. We all vaccinated our families. Everybody sitting here, bar 2, vaccinated their families with catastrophic results. Over 12,000 signatures on those 2 buses of death, death, death. When will enough be enough? How many more buses? How many more children killed? How many more injured adults? And here's a question for you, the senators. Who is going to look after our children when we, the parents, are no longer around? That can't use a toilet, that will never date. All those things Dr. Hooker said. Our children are trapped at 29, 30 years old. They will never pay taxes. They need 24-hour care because of one vaccine, one moment in time. This is a national crisis that must be addressed. And I want to thank Senator Johnson and his team for giving us this day that we thought would never come, that the world could hear really and truly what happened to the people of America who are broken. And this doesn't just affect the person with the injury, by the way. It affects the siblings. It affects the extended family. One of us has to be a carer for life. So this has to stop. And we implore you, please, to follow us at children's health events, at least break down the truth and get to the truth behind the science of what is really happening. No more Pfizer-sponsored science. We need independent science, and we need our pediatricians to stop getting bonuses for vaccinating our children. So thank you to Senator Johnson and his team.
So Ms. Tommy, when I'm watching the video, and I watch the one mom whose child died of SIDS, describing her SID support group, and every parent was talking about the vaccine. And my guess is none of their doctors talked about a vaccine. They just called it SIDS. When the other woman, the last woman whose child died, and the doctor was asking about the vaccines, when she asked the doctor, would you put that in writing, the doctor said, no. In your testimony, you said when you went to your doctor talking about how Bill was having seizures. Well, that's perfectly normal. That's common. I mean, I find that jaw-dropping.
Yeah, and it's the same story over and over again. And in fact, it is common.
That's what I want to ask you.
Because it's on the insert of the MMR vaccination, on the insert in bold letters, the seizure, so it is common. The pharmaceutical company have told us in the insert. It's the pediatricians that don't tell us what could happen to our children. They're the front line for us with our babies, and we trust them.
By the way, what is the truth? Because I hear back and forth. I mean, do pediatricians get incentivized with percent vaccination of their...
Yes, Dr. Paul Thomas has done a very good video on that, and many other pediatricians have followed. Maybe Dr. Hooker could answer better on that.
Yeah, they're typically incentivized directly by HMOs. HMOs buy and sell vaccines, so vaccines are big businesses for HMOs. But the incentivization is usually anywhere from $200 to $600 per fully vaccinated patient, as long as their vaccines, a certain percentage of their practice is fully vaccinated. So some pediatricians can make upwards to $1 million or more a year just in those incentives.
I've also heard stories of pediatricians basically firing patients because they won't get vaccinated, because that
is correct.
We hear that story over and over again. And also the lies that the pediatrician tell us that our baby will die if we don't get vitamin K at birth. The baby will bleed out before it gets to the car. And these stories, if you don't get the HPV vaccine, then you will die of cancer. These parents have told us these stories, and they're the same over and over again. How can they get away with lying like that to us, the parents?